I hope you are enjoying the North Carolina lower body course material. And these short videos are to show you evaluation and treatment of a few more patterns. I have modified the digital workbook so you will get a new link to it, and it's just better organized, okay? Also, in the workbook, you'll find a section towards the back that is called A Few Less Common Advanced Patterns, okay? In that section, there are video links that you can cut and paste, or I'll try and make them live links that you can just click on. And of course, that's for maybe 6 months from now when you feel comfortable with the basic approaches and you're finding someone that you just can't quite resolve and they don't fit in any of the patterns that you've learned to date, then you could search for those, okay? Otherwise, it'd be just overwhelming for me to present that now or even present it in the context of the workbook. There's also a very good section on improving or enhancing sitting comfort. And that is what you do with someone who has a developmental pelvic asymmetry that we are not able to correct, or a developmental asymmetry in their hip joint affecting how they sit. So if your clients, tell you they're uncomfortable sitting, certainly a cue to look at the bony development after you've gone through these different patterns to try and establish normal mobility and improve the symmetry, okay? All right. So I'll also send you just a brief handout enumerating these videos, okay? I just want to have a brief word about piriformis. I don't think we had time to do that, but the typical figure 4 piriformis stretch never, ever, ever seemed intuitive to me. It just didn't seem right. And out of developing my work and addressing the flare pattern of the pelvis, I segued into the piriformis, and we have some nice research that came out less than 10 or 15 years ago, validating that the stretches that I had been doing for such a long time are in fact ideal. And so the ideal piriformis stretch to really isolate that muscle can vary a little bit from person to person, but it looks like this. All right, so I'm going to stretch my right piriformis. So I bend my knees and I straighten out the left leg and I bring the right knee up to 90 degrees, and then I just horizontally adduct it very gently to an end range. It's not forceful, it's not firm, it's a very, very mild pressure. And you hold it, so you're not really trying to stretch it per se, you're just holding it against that barrier, or it's the most minimal force for stretching. And then you just have the patient stay there for 2 minutes, okay? And their anatomy might be a little bit different from ideal, so they can then drop the knee down about 2 inches, and that'll drop it by approximately 15 degrees, and then you repeat for 2 minutes. Then you come up again to 90, and then you come up about 2 inches, and that's approximately 15 pounds. That's about 100, that's about 15 more degrees. Same drill, very gently for 2 minutes. And that is my presentation on piriformis, and we'll stop right here. Thank you.